Hello, I'm Dr. Supriya, physiotherapist at Sancheti Hospital. Today we'll be seeing some knee exercises right from the beginning, some active exercises and progressing to some advanced exercises that will help in any knee injury or any knee surgery. So let's begin. Let's begin with some knee exercises that we can do it on the bed. So as you can see, ankles are being moved up and down. Okay, so first towards you and then down towards the wall. So this can be repeated 10 to 15 times. They help in stretching the calf muscles down as well as maintain mobility around the ankles. So this can be done more frequently. Next we move on to bending the knee. So as you can see, the person is bending the knee towards herself and then straightening it. So if you are not able to do this at the first go, you can drag your heel towards you and then straighten it. 5 repetitions on both sides and then relax. The third exercise is to stretch the hip and the knee. So you have to hold the thigh and pull it towards you as much as possible. Hold for 5 counts and relax. So this helps in stretching your hip, maintaining mobility and range around the hip and knee. Next we move on to some back mobility exercises. So both the knees have to be bent together and then move to one side and then to the other. So keeping your upper body straight, you need to twist your lower body to both sides. Next is in sitting. So extend the knee or straighten the knee upwards while maintaining your back straight. Do not lift your thigh. Repeat on each side for 5 to 10 times. This will help in maintaining the strength of the knee as well as it works on the thigh muscles. So again, this can be repeated for 5 to 10 times. Place a towel under your heel and then as you can see, you have to press your knee down towards the bed. Try to stretch your leg down so that it touches down and straightens. So this can be held for a count of 5 and then relax. So repeat this 10 times. Next we move on to bending your knee with the help of a towel. So tie the towel around your ankle and foot and then hold it in your hands. Pull the knee towards you with the help of the towel. Hold it for 5 to 10 counts and then relax. So this will help you in gaining more range and maintaining the mobility around the knee. For those who are not able to do it independently, this will help in giving you support and gaining range at the same time. Another important exercise for knee range is going on your tummy, bending one knee and helping it with the other. So as you can see, the other leg is supporting it and pushing it forward to increase the range. So knee range increases here with the help of the other knee. So push as much as you can. Hold it for 5 counts and relax. So after doing some active exercises, we move on to resisted exercises. That is providing some resistance to the leg so that muscle strength increases more. So as you can see, a weight is tied, 1 kg weight is tied to the ankle and then the exercise is done with the help of that weight. So here we are targeting the thigh muscles which help in improving the strength of the knee. So this can be repeated 5 to 10 times. Now in lying down position, you can lift the entire leg up by keeping your knee straight. This will help in increasing the strength around the hip and the thigh. So initially without holds, it can be just repeated straight up and down. On the side, so keeping the leg below bent and the leg above straight, take the leg up and down. Also keep the knee straight. So this will help in increasing the strength around the hip, particularly the gluteal muscles. Now lie on your tummy, bend your knee and take it towards you. So this will help in improving the strength of the hamstrings, improve the stability around the knee, and also maintain mobility around the knee. So repeat this on both sides for 5 to 10 times. Now keep a towel roll or a foam roller under your knee and lift your heel up to straighten the knee. Do not lift your thigh up in this. As you can see, this works on the muscles above the knee. So it will help in improving their strength and stability. Repeat it for 5 to 10 times on both sides. Next, moving on to standing exercises. So we start with squats, which are partial or in mid-range. Moving on to a stretch for the knee. So place your knee and leg on the opposite side as shown. Try to bend the knee towards the opposite side with your hand. Count for 5 to 10 counts and relax. This will stretch your thigh muscles and improve knee mobility and reduce knee pain. Your patella bone or the small round bone around the knee is important for mobility. So as shown, try to move it in all 4 directions, up, down and in and out. Move it for 5 to 10 counts in each direction to improve its mobility and functioning. Hold it properly in between 2 fingers and then move it side to side or up and down. So this is first up and down 5 to 10 times. And then sideways as shown. Five to 10 times. As a progression, you can begin with moving into more range and doing half squats. Maintain proper distance between both feet and hold your hands as shown. Initially 5 to 10 times. Next, on a step, you can start step up and step down. Begin with one leg going up and down and then with the other leg going up and down. Maintain your balance while doing this. Next is side walking with your knees slightly bent. So maintaining your upper body and back erect. Start walking sideways with your knees slightly bent. Next is a balance exercise. As seen, there is a moving surface down on which she is standing. Maintain your balance by standing with sufficient distance. Try to maintain your balance. Count for 5 to 10 counts. And then step down. You can also shift weight as shown from right to left side. Stand on one leg as a progression on the same moving surface. Gym exercises are the last part of the rehabilitation program for knees and hip. So as you can see, equipment is being used called the quadriceps table, where your knee is being strengthened. She's moving the leg up with the help of the handle, as well as bending the knee. So here we can alter the resistance with the help of the knobs provided and increase the resistance as the person is able to do more. So initially 10 to 15 repetitions can be done. Next is the leg press machine, where you have to sit comfortably with your back supported, keep your legs on the board, push it with both knees together. This will help in improving the strength of the hip and the knee, so particularly your gluteal and your quadriceps muscles as shown. Do this for 10 to 15 times and gradually increase the repetitions. The last one is the hip abductor machine. So as you can see, she's sitting erect with back supported. The legs are into the the legs are placed wide apart, and she's moving one leg after the other. So the leg has to be moved out and in, one at a time or both together. So this will also help in improving the strength of the hip. These